Now, something I've heard a few times, I'm doing okay, off the pills, but I really miss the sexual prowess it gave me. It's usually guys that say this. For men who want to last longer in bed, it's well known that certain antidepressant pills have this handy side effect. But can SSRI medication have the opposite effect? Can it cause premature ejaculation, especially after you stop taking it? I'm a psychotherapist and I work with people going through depression and anxiety. And quite often they're taking SSRI antidepressant medication, or they've come off it and they're looking for other ways to manage their mood. Or they feel that now, without the pills, they're coming too quickly, that they've developed premature ejaculation, and they worry that this might be permanent, as you would. Fluoxetine, sertraline, citalopram, paroxetine, and many more, all commonly used in the treatment of depression. Around 8 million people in the UK are on such a prescription. Now, these meds boost our serotonin levels, and it's a known side effect that this can dampen down our sexual response. Men and women often find that it takes them longer to reach orgasm. Now, this is problematic when it takes too long to get there, or we can't reach orgasm at all. But for guys, it can sometimes be a bonus, empowering them to last longer in bed. SSRIs are often prescribed to guys struggling with premature ejaculation specifically for this reason. And then there's dapoxetine, the on-demand SSRI developed specifically to treat PE. SSRIs can be quite effective in this respect, but they come with other side effects too. See my video on that. So if you're naturally on the quicker side and you take SSRI medication for any reason, you may well last longer. For some guys it makes no difference, but usually it does. And then if you stop taking the medication, you'll return to baseline, back to your normal duration. There is some anecdotal evidence of men coming quicker after taking SSRIs and coming off them. They didn't have PE, but now they do. And if they go back onto the medication, they slow down again. And if they come off it again, they speed up again. And this is massively frustrating and annoying. There's at least one reported case in the medical journals, I'll link to it below, but it was a 43-year-old man who developed premature ejaculation after he stopped taking citalopram for depression. Now, there may be other factors at play here, changes in our relationships, our general health, our stress levels. These things change over time and they all influence our sexual function. But we know that the brain chemical serotonin is a major factor too. And that's what SSRIs target. They are selective serotonin reuptake inhibitors. They keep the serotonin flowing, but only for as long as we take the meds. But there are some more organic ways to overcome PE and last longer too. And that's my point here, I think. You may be missing the superpower that SSRIs gave you. You might feel like your PE has come back, or that you have it now, and that could be plausible. But you don't need to get back on SSRIs to last longer again. Is it really a problem now? Is sex still satisfying? Is it satisfying enough? What's your partner's take on this? Remember that the average baseline for most guys is around 5 minutes, and that can be just fine for a lot of partners, especially if you get creative with sex. And if you want to be able to last longer again, skills, not pills, may be the way to go, because there's plenty you can do. See my channel for ideas and resources on this. If any of this is your experience or you're concerned that it might be, you should seek advice from your doctor. Especially around starting and stopping SSRI medication, you should taper off. Don't just stop taking it. And in the psychological profession, there's still a lot of debate about the pros and the cons of SSRI antidepressant medication. Now, I'm somewhere in the middle. I think they have a place as a treatment for depression. They can be a lifesaver, but they can be overprescribed and sometimes for too long. So I'm not being all anti-SSRIs here. They are a treatment option, even for PE if you're okay with the side effects. Now, we're still learning about the long-term effects of SSRIs, but I hope that's helped clarify things a bit. And thank you for watching.